Nearly every video I've made for the last 2 filming sessions, so like 20 videos, I keep saying that I'm gonna link a video on Meibomian gland dysfunction, and I never made that video. That video didn't exist. And so in today's video, we're gonna actually talk about the Meibomian glands, what they are, where they are, what they do, because knowledge of the Meibomian glands is absolutely critical to knowledge of dry eye. And I talk about Meibomian glands in every other video I make. So in today's video, we're gonna demystify the Meibomian glands. In today's video, we'll talk all about the Meibomian glands, what they do, where they are, and why they're important to your precious little eye holes. Welcome to Eye School with Dr. D, where my goal is to arm you with the knowledge you need to take control of your eye health and have the best vision possible. Like and subscribe for videos every week. Welcome to Eye School. I'm your host, Dr. D. The theme of Eye School is lifelong education, so I always invite you to let me know what you're learning and request videos about new topics. If you find this video informative, definitely hit that thumbs up because that's how YouTube knows it's helpful. And I'm trying to get to 10,000 subscribers, y'all. All right, we're gonna take a look at today's topic, the Meibomian glands. So the Meibomian glands are sebaceous glands that are located all along both your upper and your lower eyelids. They play a super important role in producing and protecting your tears. So they actually play a role in producing as well as like keeping the tears sealed to the surface of your eye. So this diagram that I'll show on screen shows the Meibomian glands. You can see that they're located in both the upper and lower lids and that they're long vertically and they're just kind of lined up all in a row. Their openings are located along what we call the waterline or like the edge of the eyelid. So I drew you this beautiful picture. I don't know if you can appreciate it or not, but your glands are located all the way along the lower lid. That's an eye. That's an eye. And so upper and lower. And I did a breakout. And so like, there they are. Look at them. There they are. They're on the lid. There's your nose. There's your glands. Although many of us believe that our tears come from one place, the lacrimal gland, and that they're fairly simple, maybe just water, that could not be further from the truth. In reality, your tears are produced from goblet cells of your conjunctiva, the lacrimal gland, as well as the Meibomian glands. And each and every time you blink, those little glands are gently compressed, releasing oil into your tears. And it's this oil that protects the tears and prevents them from evaporating. So if you've ever gone outside on a windy day and you felt like your eyes were burning and watering immediately, that's often a sign of a poor oily layer of your tears. Because the tears lack the top layer of oil, the watery part just evaporates quickly in the wind and causes symptoms. I also have a diagram for you that we can put on screen, or you can just feast your eyes on this lovely rendering I did of the layers of the tear film. So this mucin layer is closest to your cornea itself. That is kind of the sticky layer that holds the other layers to the eye. Then we have the aqueous layer. No, don't be fooled. It's not just water. Those are proteins and anti-inflammatories and electrolytes and things floating around in the tears. And then finally, the star of this show, the lipid layer. That's where the Meibomian glands are coming in. So your oil layer is protecting all of the other layers. Once Meibomian glands are... Stay on your toes! I'm moving fast. I know exactly where I was. I'm a professional. So the photo I'm showing you has normal glands at the top and then various stages of dysfunction in the glands in the bottom 2 photos. So you can see that the normal glands are long and skinny, they're fairly regular, and they extend all the way to the tarsal plate, or what's the fold in the lid. In photo B, many of the glands are shortened. You can see some glands that are gone, so where there's dark areas without the little white squiggly lines, those glands are gone. And once Meibomian glands are completely missing, they do not ever come back. I repeat, they are gone. Now you can still have a healthy tear film with a minimal amount of glands per eye, but it does behoove you to try not to lose those glands in the first place. Because if you can't make any oil, you'll constantly deal with evaporating tears. So I have a video for you of tears breaking up as a patient blinks, and when you have a loss of the oil in the tears, that's when you get a faster tear breakup time. Now, among other things, but certainly a lack of oil can lead to faster tear breakup time. And in that video, you see where the tears, they're supposed to be green and uniform, and they're breaking up in the areas where it's turning dark or black. In picture C, the bottom picture, the glands are very wiggly and squiggly. This is a representative of earlier stage dysfunction. This person hasn't lost any glands, but those are glands in distress. I also have a few photos for you of Meibomian glands of patients that I've seen. These are photos I've taken in my clinic. And in these photos, you can see missing and shortened glands. All of these patients were in my dry eye clinic and had symptoms. In one patient, you can see that the glands are wiggly and shortened and some are missing. And this particular patient had a history of being on retinol or Accutane in the past. So what should Meibomian gland oil look like? Well, it should be clear and fluid, just like baby oil. When the glands aren't working properly, there's a range of what the oil looks like. So clinically, I can see it as white and milky or yellow and very thick. Sometimes I just see lots of bubbles in the tears. That tends to be earlier stage Meibomian gland dysfunction, but there is a range of how it appears. So here's an example of some oil that I was able to express during a tear care procedure to clear the Meibomian glands. In this video, this patient has had 15 minutes of heat on their eyelids, and then I'm going through with an expression tool and manually getting all of that thick, backed up yellow oil out of those glands. And this patient felt so much better after having that procedure done. So what causes Meibomian gland dysfunction? Well, Demodex infestations, bacterial infections, or bacterial overpopulation of the lid margin can contribute. And that's something that happens with blepharitis. We also know that rosacea, having rosacea can contribute to Meibomian gland dysfunction, as well as environmental factors, computer use, lack of blinking can lead to a stagnation of the glands and then that characteristic thickening. Hormonal changes, retinol use or Accutane use of cosmetics and glues and other anti-aging things around the eyes. Allergic conjunctivitis can contribute, autoimmune disease, inflammation of the cornea or conjunctiva, sometimes even things like high cholesterol and preservatives. So actually, I make tons and tons and tons of videos about all the things that impact the Meibomian glands and impact dry eye, and that list is kind of ongoing all the time. So now that you've learned about what the Meibomian glands are, where they're located, what they do, and what becomes of them when they're dysfunctional, you're now prepped to watch the rest of my channel. I'll link some of my greatest hits above. You're going to want to start with this video about warm compresses as an at-home treatment for your glands. Then check out what I can do in office with tear care. Make sure to watch this video about retinol in the glands here, and stay tuned in the future for more. I talk about the Meibomian glands a lot, and if you do suffer from dry eye, it's highly likely that improving your glands would improve your symptoms. So stick around for the best tips and tricks to nurture those glands and reduce symptoms. That is it for today's lesson. I hope you enjoyed it and learned something. Remember, learning's lifelong, so stay tuned in the future by hitting that subscribe button, and I'll see you next time.